and then little drop. So this is Shannon. Shannon's been dealing with some right shoulder pain, so we're gonna work on that today. Do you want to tell us a little bit about what's going on, how long you've been experiencing the pain for, what motions bother it, and where the pain is?
Yeah, so I'm a chiropractor myself, actually, and my shoulder's been feeling okay, but just certain times when I'm doing a side posture adjustment or working a lot with larger patients, I start to feel pain over in this area and when I thrust. Yeah. So it's mostly just that, I would say.
Is it constant or is it kind of periodic?
It's periodic, yeah. Only when I work very long weeks.
Very long weeks. Okay. How's the rest of your body feeling?
Very good for the most part. I get some neck pain and then just tight upper traps and CT area.
Okay, perfect. Well, let's get started. So I'm gonna have you come scooch to the end of this table here, right here. Yeah, perfect. And we're just gonna start with a little bit of muscle work on the shoulder, okay?
Perfect.
So I'm just gonna feel around and feel what feels the most tender. You let me know if any of this is painful. So right in here at the base of your deltoid feels pretty tight to me. Same with in here, infraspinatus, rhomboid, and trap.
Yeah.
Does that feel pretty consistent?
Oh yeah.
Okay, so we're gonna start first with your traps. So I'm gonna have you shrug your shoulder up here. Bring your neck here and then drop your shoulder and lean to the left. Good. And then come shrug up and then drop your shoulder and then lean to the left. Okay, come up again. We're gonna do 2 more. And then 1 more. A little tight in there. Okay, let's do here. So starting position here and then reach over top there. So here and then reach. Any pain with this motion?
No, it just feels tight.
Okay. Good. A couple more. 1 more. Good. Okay, then I want you to arm out. I want you to kind of retract your shoulder blade. So bring your shoulder to me and then punch forward. So retract and then punch and then retract and then punch. Yep. Do you do a lot of soft tissue on your patients when you're treating?
A little bit, probably like around 5 to 10 minutes maybe.
Yeah. Yeah, it usually just depends on what's going on with people. Okay. So I'm gonna have you scooch a little bit, like right there.
Okay.
I'm gonna bring your arm up here. So I'm gonna do a little bit of work in your capsule.
I think that's what it is too, yeah.
So here, does that cause any kind of tightness or aggravation? Or this one, which one feels a little bit worse?
Inwards, yeah.
Like internal?
Yeah.
Okay. And then if I'm pushing, what about this position or this position?
Do it one more time.
So forward or backwards?
Backwards.
Backwards, okay. So I'm gonna take and place my leg up here. You're gonna be an internal. I'm gonna set my contact and then you're gonna lean towards me. Good, and then come back. Good. Can you feel the tightness in there?
That's actually where I felt it the most, yeah.
Good. And then 1 more. Yeah, so that's your capsule. Come drop down, let me see how that feels. Okay, I'm gonna do some cups around the shoulder, okay?
Nice.
Have you had cupping before?
Yes.
Yes? Do you do any cupping?
We do not, just because of timing.
Yeah.
We do some grafting, but no cupping.
Okay. So usually I do a little bit of emollient first. You can put your hair up if you like.
I was gonna say that'll probably...
Just so we don't get any emollient on your nice hair. Just gonna put a towel down underneath your bra strap, and then I'm gonna place some emollient. So I'm gonna place it on your traps, down here on your infra and subscap, rhomboid, and then a little bit here on your delt, okay?
Nice.
Okay. So I'm gonna take a smaller cup and I'm gonna be moving it today. So I'm gonna start just with 1 kind of pump. I'm gonna see how that feels. How was that? Super
Feels
painful
good.
or okay?
No, it's fine.
So I'm gonna do 2, and you can come closer so you can see the movement.
Feels really good, actually.
Yeah. So this is bringing blood flow to the area. It's also breaking up some scar tissue so you can hear it if I stop talking. I'm gonna come down, I'm gonna do your rhomboids. So these glide a lot easier down here. But you can see it's causing a little bit of redness. Good. And then let me do a bit over here.
Oh yeah.
I know.
That feels good.
Okay, I'm gonna leave that one there. I'm gonna grab a couple more. And then what I want you to do is I want you to move through some ranges of motion. So here, cross your body, so stretch. How does that feel with the movement?
Feels good.
Pause here. Okay, keep going.
You can definitely feel they're in like the right spot.
Amazing. Then I want you to do some internal external rotation. Yep. How does that feel with that motion? A little tighter on the external. Okay. And then one last one. So reach up above. Yep. And then come down. And then reach up above. And then come down. And then one more of those. Excellent. Okay, come back down. Oh, we lost one already. So we can see which ones are redder than the others. So we have a lot of nice blood flow in the area. A little bit more than we usually do.
It means it's working.
It means it's working. It means you're a little tough on your body, huh?
Yes.
Okay, so now what we're gonna do is I'm gonna have you go face down onto the table. We're gonna do a little flexion distraction. Have you ever had flexion distraction before?
I have.
So flexion distraction is gonna gap the low back joints. It's also gonna help stretch out the spine, activate the spine. It's also a great time for me to feel for what's going on inside your body. What feels tight, what feels loose, what feels like it's moving. And that'll give me kind of an indication on where I should adjust you today. How's this feeling in your low back?
Feels really good.
Good. So how many patients are you seeing every day?
Probably anywhere from like 20, 25. It's our busy season right now.
Okay, I'm gonna have you look to your right. Perfect. 20 to 25 a day.
Yes.
So your shoulder's getting a lot of work.
Yes.
Does your low back ever bother you when you're adjusting?
No, my low back's typically fine.
Okay.
I mean, like normal stiffness, sometimes from the gym, but
Yeah.
nothing crazy.
Okay. Okay, good. Do a little bit behind the knees. How many days a week are you in the gym?
I want to say most weeks 5 days a week.
Okay. Good. One more right here. Good. You can relax. I'm gonna come in and do just a tad more on the shoulder over here so you can look face down. I'm gonna have you bring your arm here to start and then reach it upwards. So right there, and then reach. Good, and then come back towards me, and then reach. Good, and then come back towards me, and then reach. And then come back, and then one more reach. And come back. Perfect. And you can relax your arm down. Actually have pretty good motion. How often do you get adjusted?
I would say at least, I try to get adjusted once a week.
Yeah. Is a little bit stiffer than on this side. Her left heel can touch the butt altogether, but in most people, when they don't get adjusted, their legs usually come to here. So, which means she has pretty good motion comparatively to a lot of people. So you're doing good. You're doing all the right things. That's what I like to see. Okay, I'm gonna first start by adjusting your mid back right here. Right here. So I'm gonna have my hands right here. Take a deep breath in, and then blow it all the way up. All the way, all the way, all the way.
Oh, nice.
Good. How was that?
It was great.
Okay.
Good.
Then I'm gonna have you come onto your right side and face me over here. I'm gonna get you. What?
I'll lift this up.
That's okay. So now you look over your left shoulder. Perfect. Amazing. So here, cross. Then the SI over here. Here.
Oh, nice.
Good. Flip to your other side.
I actually think I needed that.
Perfect. I'm just gonna find right here. It feels like it's a little bit stiff. So here, and then little drop.
Nice.
Good. Move onto your back for me. How's that headpiece?
Fine.
That feels okay. Okay, I'm gonna come up. Let's check your neck. So do you ever have headaches, or tell me a little bit about how you're feeling in your neck and traps?
So my neck, I feel like it just gets pretty locked up. Probably
Okay.
just from, bending forward, working
Yeah.
all day. And then my traps, I think that's a little bit of stress,
Okay.
and yeah, just tight muscles.
Okay. Do you feel it more on the left or the right, or both?
I would say today, right where your finger's at on the right side.
Okay.
Yeah.
Yeah, right into your suboccipitals. So suboccipitals, I don't know what you find in your patients, but for my patients, I find that when people have a lot of suboccipital tightness, it leads to a lot of headaches.
Totally.
So I can usually tell right away, does someone have headaches or not, based
Yeah.
off of what their muscles feel like. How does this side feel compared to the other side?
Definitely not as tight, I don't
Yeah.
think.
And one more. Good. And work into your traps. We'll start on this side, so just leaning towards. Good. I'm just gonna do a little bit more right in here. It's a little bit more intense this point.
I like
huh?
that, yeah.
Good. Let's feel your other side. So here. What are you training in the gym? Are you doing weights? Are you doing HIIT? Are you doing
I mostly do
classes?
weightlifting, I
Okay.
would say, and then I try to run once a week
Okay.
at least, for sure, sometimes twice, but it's mostly just weightlifting.
Yeah. Any weightlifting moves ever bother the shoulder? Or is it just adjustment based
No,
stuff?
I think, when I'm feeling my shoulder after like a long week, I just don't do upper body.
Okay.
Just kind of give it a little bit of a break, so it's been fine
Okay.
in that aspect.
Any of these moves pulling on the shoulder?
No.
Perfect.
Feels good.
I love dealing with a professional. It's nice when you know your body.
True.
Okay, so I'm gonna adjust you. So today you feel a little bit tighter to me on this left side, especially like up here.
Yeah.
Like C1, C2 area. So I'm gonna start here, okay?
It's usually always where I'm tight too.
Okay.
Yeah.
Let's see if we can get some good movement here. Good. It's one big clunk.
Mm-hmm.
Good. Let's see on this side here. Little push.
Nice.
There you go. Precise, exactly what you needed.
Mm-hmm.
A little bit of traction. Okay. I'm gonna have you now come sit up for me.
Ooh, I feel good.
Okay, good. Okay, let's do this side first. Good, so I'm gonna have you lean towards your left. Perfect. There's still a little bit of that scraping sensation, right, that you can hear. So we're just gonna relieve any more inflammation in the area. Good. I'll like lean towards your right. A little bit upwards on the neck. So you can see automatically, I know I did a little bit more work on that right side than the left, but even here on your traps, a little bit of redness, but nothing crazy.
Nice.
When we look at your right side, we have a lot more redness, a little bit more blood actually coming to the surface. So that just shows that on this right side, you have a little bit more inflammation, a little bit more scar tissue. You're definitely working this right side more than the left, okay? So making sure that you're stretching on this right side, doing, controlled articular rotation, cars, stretching, especially on that right side, is gonna help. How are you feeling?
I feel so good. My low back feels nice and loose. This feels like I can move a lot better. So
Great.
yeah,
Yay!
thank you.
Perfect. You're all set for today.
Okay, thank you.
You're welcome.